With the arrival of warmer weather in Canada, could COVID-19 spread through air circulation when it comes to air conditioning? Published in the Infectious Disease Journal, a study claimed that 9 people in Wuhan, China were infected with COVID-19 after just one asymptomatic person sat beside an air conditioning unit at a public diner.
Now, could an air conditioner have blown droplets from one person to another? It's possible. We also have to remember that that time when the study was done was when Wuhan was in the grips of this major outbreak. So even outside of the restaurant, people had a huge amount of opportunity to get the virus. So I think that that was maybe an aberration. It's something to think about, but I don't think the air conditioner played the primary role here.
Research teams at the University of Alberta analyzed this same study out of Wuhan, and it sparked a research project. A team led by Dr. Zhang is working diligently to determine if updating the design of an HVAC system could reduce the risks of airborne transmission within a confined space.
One thing is for sure is we do know that being in an indoor environment, especially with poor ventilation for a prolonged period of time, is the main way that people get infected.
So open up your windows, get outdoors, look for fresher air. This idea has been suggested by researchers in California, claiming that people should circulate indoor air in order to disperse any potential infections.
Poor ventilation in that when you're indoors, you don't have as many air exchanges. So the air that's in there is just sitting there as opposed to circulating like it would outside. So the more air circulations you have, the much less likelihood there is for a respiratory virus to spread. For example, in an old building where the air circulation is poor, that stale air will stay there while you're talking, coughing, clearing your throat, and all those droplets then can easily spread to the next person and increasing the risk of infection.
Droplet transmission still stands as the main way people become infected with COVID-19. That's according to the World Health Organization. This is why physical distancing, hand washing, and restrictions on social gatherings are still extremely important.